Hi, I thought I would give you a little update here. So let's talk pregnancy, and I'll tell you what I'm going through, what I'm experiencing, and then some of the things that if you're experiencing that pelvic floor therapy can seriously help with. So I had my appointment yesterday with Dr. Riley, and I'm currently 30 weeks, so really focusing on opening up all the muscles in the pelvis. So, right, here's pelvic floor. So we're not just focusing on these superficial muscles that will help prevent tearing, but we're really focusing on these deep muscles too. So move out my organs, and you'll see these deep third layer muscles. Oftentimes with people with really tight pelvic floor, baby has a hard time descending past that third layer of muscles. And so we're spending a ton of time just making sure, overstretching that third layer of muscles, making sure things can really open and that my pelvic floor is dynamic so I can push the baby out and hopefully prevent tearing this time around. So one of the most interesting things that I'm finding is it's so humbling, first off, to be a patient, and just experience this week after week of the pelvic care that I'm getting for my pregnancy, because it's incredible. When I had a cough a few weeks ago, I started peeing my pants again, so I was having some urinary leakage. The minute I came in for my appointment, they were able to release some of the muscles and my leakage automatically stopped. Things just went into the right place. My prolapse, my pelvic organ prolapse went into the right place, and all of a sudden I had control of my pelvic floor again. So a week of coughing and blowing my nose really flared things up for me, and even with the baby inside of me, I'm able to be totally continent and not pee my pants, which is awesome, straight up. And then the other thing that is happening is when yesterday during my session the reason I'm doing this video I wanted to share is when Dr. Riley was palpating some of my really deep hip muscles from inside the pelvis. So she was in through the vagina, palpating this muscle called the obturator internus. It immediately made me have to pee. I honestly thought I was peeing when she hit that muscle. And it just gave me this sudden urge. And really that's the urge I've been experiencing kind of for the last few days. And so urgency is like when you have to go to the bathroom, but your bladder's not full. And obviously there's a lot of pressure from the baby, sitting right on top of the bladder and making me feel like I have to go a lot. So just releasing those muscles. So I felt a ton of urgency when she hit those muscles. I was like, those are the symptoms I'm having the last couple days. The minute she released those, and it took a little bit of time because they were pretty tight, I was able to feel immediately better, and the urgency has been better. So it's something that I'm working on, keeping that loose and really making sure all the front muscles of my pelvic floor, so the front side and the back side and the superficial side, the superficial layers are extremely open and dynamic so that this baby can literally slide out of my pelvis. And if you've been listening to our birth story series on the podcast, you know that our patients are literally having their baby slide out of their pelvis with very little pushing, and most of them are just breathing their babies out, because that's also what I'm practicing, right? Is really controlling my breath with my pelvic floor. And it's hard to do that if you don't have, if you haven't been working on opening the deep layers of the pelvic floor. But really, labor and delivery can be that easy, of just being able to breathe the baby out. It's less stressful on the perineum, and I say easy, that's so not fair, but it can happen. And that's just my update on what's happening in this third trimester at 30 weeks and what my sessions for physical therapy are looking like. All right, I'll fill you guys in soon. Take care.